Peripheral vascular disease is like a beast that has left many of our patients, like this one, Mr. Vega, in a wheelchair, dependent on others. In our show today, we're going to give you information on how you can protect yourself against this disease, peripheral vascular disease. I am Dr. Cooper Dockery, and welcome to Get Healthy with Dr. Cooper.
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
The incidence of peripheral vascular disease is on the rise. There's so many diseases that can lead to this condition. Diabetes, for example, heart disease, smoking, all these are factors that can lead to peripheral vascular disease. Peripheral vascular disease can lead to amputation of the toes, amputation of the leg, or even both legs. And this is a leading factor or cause for disability. Today, I'm in the home of a patient, and I'm here to get his story because many of you probably are having a similar situation. Mr. Vega, how are you doing today?
Okay.
So, Mr. Vega, I noticed that you have one leg and amputation just below your knee.
Yes.
When did you have the amputation?
In April.
In April. What happened?
Well, my foot kept getting infected, my bone, and they said that they couldn't do nothing about it, so they had to amputate it.
Alrighty. So before that, you were telling me that you had one toe amputated, then another toe, and then they kept cutting and cutting. Is that right?
Yes.
All right. Now, you are diabetic, am I right?
Yes, since 2000.
2000. Since 2000, you're diabetic. And as a result of that, you got the infection and the poor circulation, correct?
Yes.
All right. Now, tell me, is there anything else, any other problems you have as a result of the diabetes?
Oh, my eyesight. I also lost my eyesight because of that.
Right. So you're essentially blind, am I right?
Yes.
How has this blindness affected your health?
Well, it's just, I don't know. To me, it really doesn't make a difference. I just live my own life the way I'm going, and I have to go with it.
So there is some disability there because you're unable to see. So you're a little bit more dependent on others to take care of you. Am I right?
Yes.
Okay. Is there anything else as a result of diabetes? Are you on dialysis?
Yes, I'm on dialysis. I go 3 times a week.
How long have you been on dialysis?
Since 2012.
2012. So here we can see that Mr. Vega is one of those patients who have had so many complications as a result of type 2 diabetes. Type 2 diabetes, 90% of people with type 2 diabetes can actually get rid of this disease. Is there any kind word you'd like to tell anyone who probably have diabetes, but they haven't lost their legs yet, they have their vision, and they're not on dialysis? How do you advise anyone listening or watching us?
It's like I said, like me, I just keep on living my life the way God intended. I get around. At least I have friends and families that take care of me and help me. But just gotta take care of yourself.
Right. And would you say they should probably eat differently and make sure the sugar?
Yes.
Talk about that.
Oh yes, I eat, like Dr. Cooper said, I eat a lot of salads and then fruits, and that's about it. I try to stay away from red meat. I eat some chicken and fish. Just take care of myself.
Right. So the sugar is much better controlled now that you change your diet.
Yes, I just got off of insulin.
That's right. I just took you off insulin.
Yes.
That's right.
I feel better. I mean, I don't feel tired like I used to be, and I can walk around with my leg and everything around and get around.
All right. So as you can see, that diseases such as diabetes and high blood pressure, factors such as smoking can really, really disable someone. And as you learn, peripheral vascular disease can increase your risk for many, many diseases. As a matter of fact, peripheral vascular disease will increase your risk for dying from just about any disease. So therefore, you're encouraged to take care of yourself. If you have been with us since the start of the program, you probably now understand why we want you to take better care of yourself and therefore preserve your health and prevent yourself from losing a toe, two toes, and then eventually a leg. Because when that happens, you become very dependent. Mr. Vega, thank you so much.
Yes, ma'am. Thank you, doctor.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Donna Cooper and her team are ready to help. To order her books or the DVD series Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonnacooper.com today.
Welcome back to Get Healthy with Dr. Cooper. There's so many people walking around with an amputated toe or part of the leg or the entire leg as a result of poor circulation. So the topic today is peripheral vascular disease. I have a specialist in my studio today, Dr. Pedro Megro. I'm going to call him on and he can discuss with you his title. Doctor, welcome to Get Healthy.
Thank you, Donna, for the invitation.
It's a pleasure. Why don't you have a seat? Tell us about yourself. Why are you so specialized in this area? Why are you the expert in peripheral vascular disease?
Let me tell you a little bit. After I trained in Arkansas and in cardiology and interventional cardiology, I knew that I was moving to South Texas. I knew that this population was kind of sick or higher sick than average, knowing the high prevalence in obesity, diabetes. But when I came here, I got with a surprise that I found what I was expecting, coronary artery disease, high risk of diabetes and obesity. However, I was not expecting the high number of amputations. People who already have amputations in this part of the country. And I have a formal training in peripheral artery disease during my interventional training, and I apply all that interventional training, expertise, and with time, I have been performing high-risk complications percutaneously, what means only with catheters, we know knife, only endovascular, and that is the specialty that I have. I mean, I am board certified cardiologist, interventional cardiologist, and also in endovascular medicine.
Very good. You did mention that here in South Texas, there's just a high prevalence of diabetes. That's one of the #1 risk factor for amputation of the leg.
Unfortunately, you are completely right. Similar than the coronary artery disease, diabetes is the leading cause of atherosclerotic disease in the legs as well, guiding to peripheral artery disease, as well hypertension, hyperlipidemia, smoking, family risk, obesity, renal disease, on hemodialysis is the population that is at higher risk for this devastating disease.
That's right. I know I send a lot of patients to you. Patient might come into my office with pain in the leg, walking, gives pain, is as though they're having a heart attack in their leg, right? Because there's no circulation there, right?
Probably that's a kind of an easy way to see it, and thank you for your referral, Donna. We do the best that we can to offer your patients best service, as well any patient to arrive to our office,
That's right.
the best service possible. The way how we diagnose peripheral artery disease depends in symptoms, risk factors, and there is some auxiliary tests that can help us to diagnose this medical condition. The best way to check it, simple way, can be done in the primary care office. as a screening is what is called ankle brachial index.
That's right.
Basically measuring the blood pressure in the ankles, in the brachial, and we do a ratio. No?
Right.
If it is near to 1 is normal, near to less than 0.7 is moderate, less than 5 is critically
Severe.
peripheral artery disease. That's a simple way how to stratify, but unfortunately it's not that specific. Unfortunately, there is a significant number of patients that could have normal or even elevated ankle brachial index that has severe peripheral artery disease. In the office, usually we do an ultrasound, arterial flow studies to check the circulation of the arteries in different parts of the leg. That is a very good test if there is a good technician and good physician interpreter doing that. If we are planning to do interventions, as specialists, usually with that, we straight go for interventional procedure. There are other tests that also can be done, like a CT scan or a magnetic resonance angiography. That is only reserved for persons who we anticipate that could be more complex than usual, and we can have a plan. We can plan ahead the procedure, but most of the time it's not needed, these other two tests.
That's right. So we're going to break it down for our patients. So patients who are diabetic, patients who have heart disease, they are at risk for poor circulation. We call it peripheral vascular disease, meaning therefore that the blood is not getting to the tissue, to the end point. There is some obstruction somewhere along the line. And the patient might have pain in the leg, or the patient might have an ulcer that does not heal.
Basically, the symptoms goes from asymptomatic when it's an early and mid stage, and when they become more severe, they have the typical claudication that you kind of mentioned, is pain in the calf when they walk, reduction in the physical activities because of pain, improve with rest, and if this gets worse, even has pain at rest, or even pain just lying the feet up, that produce pain. With this progressively gets worse, something comes to something is called critical limb ischemia or tissue loss. Tissue loss is that when there is an ulcer that is not healing, or some gangrenous toes, or pain at rest, that is a very critical condition in peripheral artery disease. That is a kind of similar than imminent heart attack.
That's right.
When somebody has a ulcer that is not healing for more than 2 weeks, a gangrenous toes or gangrenous tissue, and pain at rest, something to remember.
Let's talk about gangrene, because our audience might be thinking, what's gangrene?
Gangrene basically is the terminal stage of the tissue. We see a healthy tissue, pink, or depends the color of the skin, warm. When the circulation gets poor, becomes colder, becomes the skin becomes thinner, the hair it becomes to get lost, and when this becomes even worse, become pale. When this becomes even worse, becomes dark.
Dark and
or
cold.
dark tissue, very cold. That means the tissue is already dead.
That's right.
Gangrenous means already the tissue is dead. And unfortunately, when the tissue is dead, it requires amputation.
Yeah, there's nothing you can do. It's die because there's absolutely no blood flow.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935.
So as you say, initially, no symptoms, but then the patient might have pain in the calf when they walk, or they might have cold limb, blue limb,
Absolutely.
loss of hair, shiny skin, and of course you mentioned the ulcer that does not heal. No, I send those patients to you, doctor. What do you do with those patients when you see them?
When already we did a diagnosis with non-invasive testing and we confirm the presence of severe disease, we perform an angiogram. Angiogram is the gold standard, the test that is done in the hospital, in which we put a catheter. It could be in the groin, or it could be in the tibial arteries in the next to the feet, And with that, we can visualize the arteries inside the legs, in this case, to confirm the severity of the disease. And if the presence of severe disease is there, usually we fix it percutaneously. That is my specialty.
You know, a lot of patients will ask me, how can they fix it when the vessel is so tiny?
Very true. We are talking about 2-3 millimeters arteries in the runoffs below the knee. Above the knee is significantly higher. No? But let me tell you, we as a cardiologist and interventional cardiology, we are trained to perform these procedures in the heart.
So imagine
the heart that is moving, the heart that has a lot of tortuosity arteries, that has a lot of branches. That means for an interventional cardiologist that has been working in a small area in the heart, doing the legs is
easier.
Is significantly less challenge. However, I have to say that has their own challenge per se. You need to have create your own expertise, your own techniques. And also there are more tools in the legs than even in the heart to do the atherectomy or cleaning of these arteries.
Right. Who are the patients at risk for amputation?
Unfortunately, any patient who presents in these 3 stages, ulcers that are not healing, gangrenous toes, pains at rest, are at very high risk for amputation. And unfortunately, something that people don't know is having amputation is higher risk than almost any cancer. Mortality in somebody who has a toe amputation at less than a year is more than 25%.
When you say mortality, what do you mean? So
Any kind of mortality, cardiac, non-cardiac mortality. These patients usually that has amputation, they are in dialysis, they have long history of diabetes, they have usually other comorbidities different just the peripheral artery disease. Most of them, they already have blockages in the heart, weak heart, cardiomyopathy, or other risk factors. In that way, mortality is more than 25% at 1 year. Risk of amputation in the other limb is more than 50% in 1 year. And when I am talking amputation, I am talking a large amputation below the knee or above the knee. What means is a condition that is unfortunately at very high risk. Also, this having a below the knee amputation, to tell you the truth, majority of the patients, they don't walk anymore. They are not able to get a prosthesis and ambulate again.
That's right.
Because, again, the other comorbidities. No? Usually these patients are kind of sicker than usual population.
Right. So we want to prevent the disease because as the doctor says that by the time the patient gets any amputation, the risk of death from anything is very high. Am I right?
You are completely right.
Right. Do you have any videos you brought us so that we can look at?
Yeah, I brought several videos.
Let's
and
walk
we can
over
go there.
here and see what you have.
Unfortunately, we have some technical difficulties, and the videos has been very difficult to see. However, we put some pictures.
Okay, let's
in
look.
that way, we can kind of. I think that the idea and the message will be able to be appreciated, and the arteries are like a tube system, no? Circulatory. The circulation basically is a continuation of tubes, and we are going to see the dark part is the arteries. You can go next, please.
Okay.
Oh, for example, this is a patient, 54, diabetic, who presented initially to another hospital, was transferred to the hospital where I practice, and you clearly can see a gangrenous toe.
That's
The
right.
foretoe is gangrenous, and you can see the distal part of the foot has redness, what is ischemia, pain at rest, in swelling, already
So
inflammation.
this toe is already dead. That's exactly what we mean.
Unfortunately, that toe is already dead.
All right.
But he already has been recommended above the knee amputation in another hospital. And he came to us, or to me in this
To
case,
save the leg.
basically as a second or even third opinion, because 2 doctors told him they will require amputation. And obviously, 54-year-old male, I mean, having an amputation above the knee basically is almost the end of his life,
That's right.
of productive life, I mean. And it basically will be a very, very difficult situation. No? If you can go to the next.
The next.
Yeah, unfortunately, go to the next. Oh, here, wait a second. Well, can you go back? If you can see, for example, in this patient, they told him they will require above the knee amputation, but the doctor was not sure it will be above or below. In this case, it's because, unfortunately, peripheral artery disease usually is a multi-level disease. No? In this case, it's in the iliac artery. This is the hip. We are talking about the aorta bifurcation in both iliac arteries. This is in the iliac artery. Left common iliac artery has a tight stenosis. The videos has not been able to be done, but you can show you the results, how is this finished. Now you can clearly see a very tight stenosis, and this is how it finished.
Fantastic, great job here. Because
Thank
on that one, you hardly see the flow. It's very obvious there's no flow there. And then you opened up, and then there's great flow. Fantastic.
Thank you.
Anything else?
Yes, basically in the same patient, you can go next, you can see a significant blockage at the level of the knee. And here also, this is the popliteal artery, the tibio-peroneal trunk also has severe disease, anterior tibialis, and here you can see the anterior tibialis totally occluded in this segment. No? And you clearly can see the popliteal, tibio-peroneal trunk, anterior tibialis, and also we recover this artery. Next, please.
Okay.
Here is the artery that was obstructed 100%, and now the anterior tibialis that is present all the way to the foot. And you can go next. And initially, the foot circulation was very limited, and clearly you can see now the dorsalis pedis with circulation to the toes.
Beautiful, beautiful.
You can go one more. In this gentleman, from above the knee amputation that was recommended in another hospital, from this you can go just to a toe amputation.
Right, and you can see the difference in the skin color here after the circulation is open.
That was approximately 6 weeks after. Clearly you can see the ischemic foot, the redness, you can see the swelling, the shiny skin, and this you can see already a skin with no more swelling and obviously no signs of ischemia.
Very good job, Doc.
I know that losing a toe, could look bad. However, losing a toe is nothing comparing to the leg below or above the knee.
I agree.
No? Especially in a 54-year-old person.
Who's very young.
Dr. Donna Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonnacooper.com.
Let's see what Adrian has for us. I think he has some question on the street about peripheral vascular disease. Let's go to Adrian.
Hi, Dr. Cooper. I'm here with...
Araceli Huerta.
She has a question for you.
What are the causes for the peripheral vascular disease?
Doctor.
Yeah, basically the causes are diabetes as a number one factor, hypertension, hyperlipidemia, smoking, family risk, evidence of atherosclerotic disease in other parts of the body, obesity, and renal disease on hemodialysis.
That's right. So really they're just the same as that of coronary artery disease.
Unfortunately, atherosclerotic disease is a systemic disease.
That's right.
It does not affect only the heart, affects also the brain, risk for a stroke, heart, risk for heart attack, and the legs with risk of amputation.
Very good. Anything else? Any other question from Adrian?
Hi, Dr. Cooper. I'm here with...
Lina.
And today she has a question for you.
Hi, Dr. Cooper. What is the symptom of peripheral vascular disease?
Alrighty, so we discussed that already, Doc, but you can probably just give a brief overview of the symptoms again.
Like we mentioned, it goes from asymptomatic in the early and mid stage to claudications or atypical pain in the legs when it's moderate and severe disease. And when it's very critical stage is when it's non-healing ulcer, pain at rest, or gangrenous toes or tissue.
Very good. So this has been quite enlightening for our viewers. Peripheral vascular disease is something you can prevent because if you have amputation, your risk of death is higher than the general population.
Much higher.
That's right. Doctor, I thank you so much for
My
coming.
pleasure, Dr. Cooper.
And I'll have you again soon. Don't go away, we'll be right back.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Donna Cooper and her team are ready to help. To order her books or the DVD series, Get Healthy for Life and 14 Days to Amazing Health, Call 1-844-343-8935 or go to drdonnacooper.com today.
Welcome.
Hey everybody, welcome to the kitchen segment.
So what do we have today, Chef?
Today we are going to be making cheese.
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 Are you sure?
I am positively sure we're going to be making some cheese.
All right, but without the cholesterol.
Without the cholesterol, without the calories, healthy, delicious
Good.
cheese.
And good for your blood vessels. So go ahead, Chef.
So we come over here, we have our blender ready to go. We add our water in first so everything can move around nicely. And we're gonna add our cashews,
Right.
natural cashews.
High in
Protein.
And that's the base for our cheese.
It really is. We have some garlic powder, onion powder,
These are great for your immune system. Remember that.
salt, very little salt, lemon juice,
Lemon, fantastic with vitamin C.
some pimientos,
Pimientos, and that's made from red bell pepper.
red bell pepper, which will give us our color for our cheese.
Yes, and a lot of vitamin A and antioxidant.
We have some cornstarch that's gonna help us get thick as we go. And we have some nutritional yeast.
And that is wonderful source for our B vitamins, especially B12.
Rich in our vitamin. So we're gonna turn our blender. You're probably at home saying that does not look like cheese, chef. You tricked us.
wait till
Well,
the end.
now we're gonna add it into our pot here.
And you're gonna cook this for how long, Chef?
This will go for 10 to 15 minutes with a continuous
Stir. And why do we have to stir it continuously?
stick to the bottom of our pan. And as soon as you keep on stirring it, you increase the heat a little bit, you'll see it'll start getting thicker and thicker.
Right, so you keep it cooked until it's thick enough, looking like a cheese sauce.
It smells like cheese already.
It looks good.
It looks like cheese.
And I know it tastes good too.
Yes, it does. Yes,
know?
it does.
There are a lot of kids who do not like their vegetables. So we use this as a wonderful vegetable spread.
Oh, yes.
So here's the way we're gonna use this spread here. Very delicious. Look at the finished product.
Looks like cheese.
It is thick, it looks like cheese, and it tastes like cheese. Now for those of you who like to have macaroni and cheese,
yes.
this is wonderful. But remember, you need to use the whole grain macaroni. Higher in fiber and higher in protein. And we are in South Texas. Wow. So those of you who like nachos,
Nachos.
that is a nachos cheese sauce, and this
Yes,
is
it is.
delicious.
Yes, it is. It's got that nice hint because of the bell peppers.
That's right, beautiful color and beautiful flavor to the garlic and the onion.
And everything
and
comes
the
together.
flakes, the
Yes,
nutritional yeast.
those flakes, once you smell them, you're gonna be, it smells cheddar-like, and now it's starting to give us that texture and all that nice smell that the cheese comes with.
Very good. So remember, we discussed peripheral vascular disease, and one of the risk factors is high cholesterol. You don't want to have cholesterol, so then this is a great substitute.
This is the best substitute.
What do we taste? I want to taste this thing, Chef. Let's
This
see.
is my
You wanna
favorite
taste?
part of the kitchen.
Delicious. Now, for more recipe, go to our website, cooperwellnesscenter.com, and follow us on Facebook. We'll see you again soon.